Through July, when Canberra was a COVID-free oasis,
where was the location?
Its contact tracing team was busy at work assisting New South Wales with the rapidly escalating Delta outbreak in Sydney.
We don't know the suburbs so well in Sydney, so a lot of our people that were doing the interviews did comment that it's very, very challenging.
I have about 6 more contacts to do at the moment.
Okay.
Behind all the interstate bickering that has dominated the politics of this pandemic, there has been a quiet, effective layer of interstate cooperation on health resources, like vital contact tracing.
Last year we sent some of our staff down to Victoria. I think it was in about July last year when they had their first sort of outbreak down there. Everyone's been open to calling in that help.
But it's a fragile web, and almost like in bushfire season, the capacity to offer help depends on one's own state not being ablaze.
It's the Canberra club that's led to a COVID cluster.
When the virus finally arrived in the capital a few weeks ago, Rebecca Hundy had no choice but to pull her team back.
It was pretty much immediate. It was all hands on deck from that first moment. We just pulled all of our own resources in to focus on that case.
The rest of the country might just see Canberra as the home of the federal parliament, some as a population of fat cat public servants and an affluent middle class. But despite its reputation, when COVID arrived in the city after it was virus-free for a year, Chief Minister Andrew Barr saw the national capital rapidly tick almost every unwanted box on the COVID bingo card.
Vulnerable communities, public housing, community housing, homelessness, shelters, people who are sleeping rough becoming infected.
The detection of COVID in just 2 Canberra schools made 20,000 people, or close to 5% of the entire population, close contacts who had to go into quarantine, not just lockdown. Finding them was a lot easier, but it still had a massive impact on the city.
And that impacted on frontline health workers, it impacted on policing, it impacted on our emergency services agency and on government's ability to deliver our pandemic response. It also flowed through into the private sector as well. So very significant implications from having, it's not just your caseload, it's also all of the people who then have to isolate and quarantine.
And Canberra's future could be instructive for the rest of the nation too, as it attempts to maintain very low levels of the virus while literally surrounded by a jurisdiction taking a different course. The Doherty Institute's modelling says Australia can handle an outbreak without too much death after 80% of our people are vaccinated without lockdowns, but on the presumption that our infection control measures like contact tracing are running at an optimal level.
Even in a city like Canberra, in a community like Canberra, that we've been able to get about 85% of our cases linked, and linked pretty quickly. But there are still mystery cases, even in a community that's not quite 500,000 people.
The potential incubation period is so much shorter. So in terms of that ability to get people into quarantine before they're infectious, that opportunity has been shortened.
The sheer weight of numbers, the outbreaks in particular communities, and the rapid infection rates of the Delta variant are changing the way contact tracing is working and what contribution it will play in the future.
In Western Australia, we've been able to maintain assistance to other states pretty much throughout.
Unlike the ACT, WA is still free of COVID, so its contact tracers are still helping with the Sydney outbreak.
Was it during the same time?
Casual observers may think that, at over 1,000 cases a day, the Sydney cluster would simply be too big to trace, but not so.
The basic principles of contact tracing are of benefit if you have one case in your community or if you have more than 1,000.
Initially it was very big, yeah.
The role of contact tracing is really a targeted form of lockdown. So rather than the whole community being asked to stay at home, we find those most at risk of getting COVID and we ask them to stay at home.
It may be that, as probably New South Wales are finding now with so many cases, you may have to prioritise certain cases, high risk settings like aged care facilities, schools, that kind of thing. If you can focus on households and protecting those people who are, more vulnerable to the disease, that I think is where we can have the most impact with the contact tracing.
We are entering a transition phase at the moment. The role of contact tracing will change as more people catch the virus but may not show signs of having it because they are vaccinated. There is more talk about the use of rapid tests for COVID and for more home quarantine. Vaccination rates are thankfully starting to really accelerate. The transition phase is likely to last through September and October at least. But the changeover in the mix of public health responses could be a brief but critical window of time.
This really all comes down to a critical probably 2 to 4 weeks where we aim to get well above 70%, cross the 80% threshold and hopefully go beyond. And that's the period of greatest risk where the test, trace, isolate and quarantine capability, TTIQ, will not be as effective.
So when's that period going to be?
I think it's going to vary actually across the nation. In New South Wales, ACT and Victoria, it could well be October, November into early December. For some other states, it might be more November and December.
Part of that will depend on when different jurisdictions reach vaccination targets, but part of it will depend on the politics of staying closed or opening up.
We need to be having some serious discussions.
Last week, Queensland Premier Anastasia Palaszczuk was condemned for arguing the Doherty Institute modelling suggested 80 people a day would die at 70% vaccination rates. Today, New South Wales Premier Gladys Berejiklian suggested her state could be opened up to doubly vaccinated people at 70%.
When we get to 70% in New South Wales, there's no doubt people will experience many more freedoms, much more freedoms than what we're experiencing today.
In charge of a jurisdiction that is both small and which was COVID-free for a year, Andrew Barr is an interesting participant and observer of the political brawls taking place among his colleagues in the National Cabinet. Is it too political?
On balance, I think the National Cabinet has been a net positive. It's been a moderating influence on some of the Prime Minister's early instincts. It's also helped to allow premiers and chief ministers to discuss issues, to moderate each other a little, not fully, clearly. And I think this group of First Ministers have met more than any other in Australian history. Sometimes that puts us into conflict, but a lot of the time it's led to better decisions and better pandemic management for Australia.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.